My name is Carolyne Nyarangi. I'm a psychologist and with a special focus when it comes to adolescents. When there were questions that were raised today, I think I voted no to everything. Did anybody else do that? Just me. I'm a special case then. Moving on, let's have a look at hashtags to health. So most of the work you've had is more like research. But today I'm going to present to you, this is a pilot project, and it sits at the intersection of digital health, digital platforms, SRHR and HIV, and then we have mental health. So you have a question, why mental health, why digital platforms? First, looking around, everybody has a phone, like 90%, am I right? Yes, so that's the digital world for you. And how does it come in handy when we are talking about SRHR and HIV? These platforms bring about information for adolescents. They learn from there, they socialize from there, and they make fun of the old people like us. Well, and that's why it's very helpful. But on one hand, while it's helpful, it has some disadvantages. So it exposes adolescents to other effects. Let me share a little story, if time allows. A friend of mine, she was 19 years old. She was diagnosed with HIV. So back then, that's when we were getting hold of phones and the internet. She went to the internet, Googled something, and the following morning she calls me and says, Caroline, what's the use of trying? I didn't know, was I trying to cook? Was I trying to tell her something? I was very much confused. It turns out what she learned was, if you are, I forgot about this completely. If you are, sorry, I've got no conflict of interest. Sorry, let's go back. There, no conflict of interest to declare. So what she learned from the internet was, if you have HIV, it takes 3 to 6 months and you're dead. So she was devastated. She didn't know what to do or who to talk to. So that's why digital platforms come in, and that's the misinformation we are talking about. Hashtag to health is looking at teaching these adolescents on how to trust the internet, on how to use it responsibly and what to do with it. And then why mental health when it comes to SRHR and HIV? Mental health can be an enabler and a barrier when it comes to HIV and the sexual reproductive systems for adolescents, because an adolescent that's supported emotionally can be able to make right choices. And that's the digital adolescence I've briefly touched about. I hope that's fine for now. So what's our primary objectives? We are looking at integrating mental health like screening, psychosocial support, and channels that adolescents can use. We are looking at increasing the knowledge that's gonna help with the misinformation. And we are building the adolescents' digital literacy so that they can navigate the digital platforms in a better way, I guess. And then we are looking at creating a safe, moderated peer support space, which has a feedback loop, of course. This is what research says about the digital world and adolescents. The social media campaigns like End Teeny Pregnancy, Know Your Status, they did very well. I think the only challenge was the sustained engagement that they didn't have. And then we have controlled trials like Zambia's Yes and Kenya's Inuka coaching. So that is digital plus peer plus mental health integration. The pilot project looks at having engaging content, like short videos for TikTok. I know it's very famous right now and very useful. Peer-led discussions and quizzes, of course. So the platforms we are looking at are the same: WhatsApp, TikTok, Instagram, the same ones that adolescents are very conversant with. And then we're going to add some features like the stress screeners, referral pathways, and the peer mentors. This, from hashtag to health, we really want to involve the adolescents. They're going to do 90% of the job. And I hope I'll be sitting somewhere with my phone on social media doing something, watching TikTok videos. Then we have the cultural tailoring. We'll make sure that the languages, the visuals, and the community norms are integrated in that. And lastly, the privacy and trust. We'll try to secure logins, minimal data capture, and helpline referrals. So the implementation period, I see I've got a minute, is going to be 10 to 12 weeks. We'll have the content I've mentioned. We have moderated WhatsApp peer groups. We have stress screeners for mental health, SMS reminders, and the last one would be real-time analytics and monitoring. The digital tools, I think I've spoken on this a little bit, so we can move on. So these are the results. If you can take a picture, like testing the uptake of HIV, we're hoping that it's gonna go up. We have, let me touch on the last one, which is the engagement from and trust in digital health tools. Because maybe because I voted no, meaning I don't trust the AI 100%, we're going to work on that so that the youth are not like me, they trust it a little bit. Conclusion, I think the integration of mental health, the digital platforms, SRHR and HIV, is a very important aspect that we should all focus on. I'm hoping that the discussion doesn't end here. When we step out for breaks or something, we keep on the conversation going. Lastly, I would like to thank the conference organizers and Cognicare Coaching and Wellness Hub for their support. Thank you very much.